Hello, and thank you for watching. My name is Dr. Laverne Chandler. This week, I would like to revisit the topic of suicide. And in the upcoming weeks, I will have some special guests who are willing to share their stories with us. In the future, I will be going live on Facebook bi-weekly to discuss other topics surrounding mental illness. Losing a loved one to suicide is probably one of the most devastating experiences a person can go through. And when a celebrity commits suicide, the effects on their personal family and the entire world. On the surface, it may seem like celebrities have perfect lives. When the actor and the comedian Robin Williams committed suicide, fans were left devastated. I often heard individuals say, how can a person who can make anyone laugh get so sad and their lives become so delusional that they end up killing themselves? In my era, Don Cornelius was a television show host, the creator of the sophisticated dance and music show called Soul Train. Some of you may remember that show. Don had the ability to make people laugh. He brought different dance moves directly into our living rooms. However, his life ended tragically because of suicide. August Ames, a beautiful, beloved star, took her life at an early age, at the age of 23. She had her entire life ahead of her. Yet, she hung herself due to cyberbullying. Andre Waters, an American football star, played for the Philadelphia Eagles and the Arizona Cardinals, ended his life in suicide. Our latest star, Mr. Stephen Laurel Twitch Boss, an American freestyle hip-hop dancer, choreographer. He was an actor, television producer, television personality whose death was ruled as a suicide. We as a society and in a country need to understand that famous people experience pain and disappointments because yet they are still human. Suicide is the act of intentionally causing one's own death. Some people attempt suicide. What is attempted suicide? Attempt suicide is a person that causes self-injury to themselves. They have a desire to end their lives, but it does not result in death. Assisted suicide is a new term that has come to pass now. It's when a person helps another person to bring about their death by indirectly providing advice or the means to an end for another person to end their lives. Yes, another topic, murder-suicide. Murder-suicide is also called homicide. It's when an individual takes the lives of others and his life at the same time. This is known to happen and sometimes it's prevalent in our society today. Let's look at some methods of suicide, which are also very important. The most commonly adopted method of suicide varies from country to country. Common methods of suicide include hanging, pesticide, poisoning, and the number one method of suicide is firearms. Let's switch gears a little bit. What are some causes of suicide? Mental disorders such as depression, bipolar, schizophrenia, personality disorders, anxiety disorders, physical disorders such as chronic fatigue syndrome, and substance abuse, including alcoholism, is the number one causes of persons committing suicide. Yes, we need to understand that some suicides are impulsive. Some suicides are due to the act of stress, such as financial or academic difficulties, relationship problems such as breakups or divorces, harassment, and yes, even bullying. For example, suicide rates have been found to be greater in households who own firearms, other than houses who do not own firearms. Social economic problems such as unemployment, poverty, homelessness, discrimination can trigger suicide thoughts. When someone does not have a place to live, it makes them at greater risk of suicide. Trauma is a risk factor in suicide, especially in children. Some may take their own lives to escape bullying, prejudice, or other traumas where they have endured in their household. A history of childhood sexual abuse and time spent in foster care is also a risk factor. Sexual abuse is believed to contribute to approximately 20% of the overall risk of someone committing suicide. Let's think about another topic that many don't talk about: genetics. A family history of suicide, especially in the mother, affects children more than adolescents or adults. There are many risk factors that increase the risk of suicide, and we're going to talk about just a few more because they're very important and I need to bring them out. A number of psychological factors increase the risk of suicide, including hopelessness, loss of pleasure in life, depression, agitation, rigid thinking, poor coping skills. When a person has issues with learning how to cope, many times life stressors such as a loss of a family member or a friend or loss of a job may also be some contributing factors that causes one to even contemplate suicide. Social isolation, the lack of social support, has been associated with an increased risk of suicide as well. Poverty is also a factor that heightens a person thinking about suicide. How am I going to pay my bills? Where am I going to live? How am I going to eat? I have to decide whether to pay the rent or buy something to eat. Substance misuse is the second most common risk factor for suicide. Both chronic substance misuse as well as acute intoxication are also risk factors for persons who commit suicide. When you combine those two things with personal grief, such as bereavement, the risks are even further increased. Substance misuse is also associated with mental health disorders. Many people who are under the influence of drugs and alcohol are even more at risk for committing suicide. When alcohol is present, it can cause up to 15%, up to 61% of the cases of persons that have committed suicide. About 3.4% of those who have been treated for alcohol at some point in their lives, oftentimes in their lives in suicide. Alcoholics who attempt suicide are usually male and older individuals, and they have tried at one time or another to commit suicide in their past. Between 3 and 35% of death among those who are on heroin also commit suicide. In adolescents who misuse alcohol and who have a lot of neurological dysfunctions, it may also contribute to them with an increased risk of suicide. The misuse of cocaine and methamphetamines has a higher correlation with suicide. And those who use cocaine also have a greater risk during the withdrawal phase of committing suicide. The withdrawals are horrific, so sometimes individuals don't know how to handle that, and it causes them to commit suicide. Medical conditions is another risk factor surrounding suicide. When I say medical conditions, problems such as chronic pain, brain injury, cancer, chronic fatigue syndrome, kidney failure, and the number one also, HIV and AIDS. Serious disorders and diagnosis of cancer double the frequency of suicide. Sleep disturbances such as insomnia, sleep apnea, narcolepsy are also risk factors for depression, which can cause suicide. In some instances, the sleep disturbances may be a risk factor independent of depression. Let's think about genetics. Genetics appears to account for more than 38% of suicide behaviors, and that percent can go all the way up to 55%. Suicide is often seen as a major issue in families, relatives, and what happens is when people see this, suicide is looked upon as being negative around the world. So I would ask the question, who is at greater risk of suicide? Those who have previously attempted suicide are at a higher risk and may also be the ones who will try suicide later on in the future. If they tried it once, they may try it again. Approximately 20% of suicides have a previous attempt, and those who have attempted suicide, 1% die by suicide within a year. For those who have attempted suicide on the second time, at least 5% of them die within a 10-year window. The media includes the internet, which also plays an important part of someone getting the idea of how to kill themselves. It's often anything you want to learn, go to the internet. When persons who are already vulnerable want to kill themselves, if they go to the internet and learn a way to do it, they're more likely to try it. Statistics tells us suicides result in 825 million deaths globally that happened in 2015. There was an increase of 715 million in 1990. This makes suicide the 10th leading cause of death worldwide. Approximately 1.5% of all deaths worldwide are by suicide. That means when you see or hear about 100 million people, about 12 of those people will commit suicide. There's an estimate that 10 to 20 million non-fatal attempts of suicide happen every single year. About 15 to 40% of people leave a suicide note when they commit suicide, or they will leave some other type of information to show why they committed it. Others do not. Rates of suicide are generally higher in men than in women. However, suicide rates tend to vary from country to country. For instance, looking at statistics, Europe has the highest rate of suicide. But when we think about the Western world, attempts are more common among young people and women more so than of men. When you think about war veterans, they have a higher rate of suicide due to mental illness, such as post-traumatic stress syndrome. They have physical health, brain injuries, loss of their legs, their arms, their eyes, due to related war injuries, which cause them to commit suicide. When we think about suicide, there are two different types of suicide people: active suicide and passive suicide. Passive suicide thoughts from individuals who think about suicide is a little bit different than active. Passive suicide thoughts occurs when an individual has no longer the motivation to live, but they don't have a plan to end their lives. They will say things like, "I wish I could go to sleep and not wake up. I just wonder what it feels like if the fog in my brain would just disappear." Or, "I wish that the world would just end it tomorrow," or just end today. Treatment for persons who have passive suicide thoughts is a severe health concern and should be taken very seriously. Reason being, they need some level of treatment. However, the level of treatment depends on the person, their support system, and their state of mind when they are conveying these things to either you or even a professional. Me personally, I recommend anyone experiencing these thoughts to be evaluated by a mental health professional. An important question to ask someone who's having passive suicide thoughts is, can you commit to stay safe for the next 24 hours? If the answer is yes, I recommend setting the person up with a mental health assessment, some type of mental health therapy, and intense treatment within 24 hours, because that is the commitment that they have given you. However, things changes if the answer is no. I recommend immediately taking the person to the emergency room or a nearby psychiatric hospital for evaluation and inpatient hospitalization. They need to be hospitalized. Active suicide thoughts differ from passive because not only does the person not have the motivation to live, but they have a plan to end their lives. Active suicide sounds like, it would be so easy to end my life. I just want to die. My family would be better off without me, so I just need to kill myself. I'm no good to no one here on earth. I just want to end it all. Treatment for active suicidal thoughts. Those who have a plan to end their lives and have the means to carry out their plan are at high risk for suicide and should be hospitalized immediately. If a person begin to tell you the things that I have stated, they need to be taken to the hospital expeditiously. While the person is hospitalized, the support system is going to be great for them. The hospitalization causes them for a safe environment, and also it maintains a high standard of safety for the individual. An inpatient treatment setting, the person will be evaluated by psychiatrists. They will have to attend individual therapy, participate in group therapy, and they will be taught coping skills to be able to help them and give them the tools they need to be safe, and also be able to help them realize what is going on. Oftentimes, they're often given medications to help stabilize their moods. Please pay attention to your husbands, your wives, your children, other family members, church family, your neighbors, your friends, colleagues, and yes, even strangers that you may meet. Calling the police or taking someone to the emergency one could save someone's life. Remember, we are our brother's keeper. Thank you so much for watching. My name is Dr. Laverne Chandler. I'm your host. And for those who are new to my channel, please like, share, and subscribe. And for my followers, thanks so much for your support. And I'll see you in the upcoming weeks. Bye for now.